All right. Now, you might have been to a Tupperware party. How about a botox party? It's an occasion where women hang out with their friends, drink a bit of grog, and have botox injections.
They're increasingly popular, apparently, but now they could be banned across New South Wales. The state government has ordered a review into the entire cosmetic surgery industry. Dr. John Darcy is our medical editor. He is with us this morning. Doc, good morning to you.
Good morning.
What are the dangers associated with these types of parties?
Well, I suppose it gets back to what we said last week, really. You know, if you're fiddling with your face or with your hands or any part of your body, you can do some damage. Now, okay, I admit Botox is one of the best things that a qualified person can use to get rid of some wrinkles for a short period of time, maybe 2 or 3 months, and it looks very, very simple. But if you stick that needle in the wrong spot, it's botulinum toxin. It's a toxin. It can have very serious effects.
Well, it's like a little poison.
It's like it's a little mini poison. In large doses, it's a killer. So if you put, I mean, the botulinum toxin is, so if you put it in the wrong spot, and you put it, say, on the facial nerve or in around the facial nerve, you can get some quite severe problems. Look, that's not just the main thing. As you can see from this, they're very small needles, and although you do need medical qualifications to give it in the most appropriate way, the sense is, it's just a simple matter of subcutaneously sticking it around the eyes to get rid of those crow's feet, etc. The sense of it is a simple sense. And people say, why not? Few grogs. Yes, I do want my eyes done. Look at that. I want it fixed. And so you can understand why people would think it was a simple thing to do. But it ain't a simple thing to do. And it doesn't always work the way you want it to.
I just sort of thought, I don't know, I just assumed any sort of medical procedure to have it done in someone's home with their champagne flowing just seems really frightening. I don't know, I just assumed it's something that you'd want to have done in a clinic where you know somebody is fully qualified and it's safe. And
that's exactly right. Now look, I did say last week, and I'll say it again, there are some very, very good cosmetic surgeons, but you don't have to have the degrees that you do if you're a plastic surgeon, for example, to do it. And so as a result, the wrong sort of people can end up sticking these needles where they shouldn't be stuck. So it's not a good idea, and you can see why the government wants to dampen it down to make people realise this is a medical procedure. It's not something that, as you say, you have after you've had a bit of champagne. You say, yeah, I do think I need those crow's feet done. Oh yeah, would you do it for me? So it's not a good idea.
So what are some of, you're saying if it goes wrong, what can happen if it goes wrong?
The majority of things that would go wrong is that they'd stick it in the wrong place and you'd look funny for a couple of months. So you might be able to say, well, I look funny for a couple of months, I'm going to get better. And that's the general
It's frozen,
sense.
isn't it? Doesn't it kind of... You look,
doesn't it?
Yeah,
I think, isn't that what it does? It freezes it or something?
Well, it doesn't freeze it exactly, but what it stops the nerves acting to pull the little bits of the skin together, say with a crow's foot or something. You might look a bit funny, but the real issue is if you stick that needle in the wrong spot where there is a major nerve, that's when you could get some serious difficulties. Also gets back to the emotional side of things. People who want these things done, they should have them done if they want them done. But you're right, they should go to the right sort of place, and I always say they should go to a plastic surgeon to have it done. It's a real issue, it's a medical issue, it's not a cosmetic issue necessarily that should be done with a bottle of champagne hanging around the back.
That's what worries me. In a room with my girlfriends drinking champagne, I probably agree
Right.
with a lot of other things that I wouldn't normally in the light of day.
Mel gets a couple of drinks in her, she can do anything.
No, but you'd suddenly be thinking, oh yeah, look, you know, do a bit more while...
That's right. Yeah, what did you do down here and around my knees as well?
Yeah, well,
What would you like done?
It scares me. The thought of sticking botulism in my face just scares... I'm worried about I'm sure it's safe, but I'm worried about 20 years from now when...
Oh, no. It is safe done properly. Let me just say that. It's a very good product, but it's got to be done with the right person with the right qualifications.
Okay, Doc. Thank you for that. A very good warning.
Yes.
All right.
Okay, we cleared all that up, okay.